Hello everyone, this is Chadi Alraies from SIF 2024 and this is 20th year anniversary for SIF. I'm really privileged as every year to be with Dr. Morton Kern and this time he's coming to us with an overview of the last 2 days of SIF.
Yes, so it's a pleasure to be here again too, and with you as well, Chadi.
Thank you.
The SIF meeting now, this is its 20th anniversary meeting, and I've been involved with David Rising from the very beginning.
Wow.
And I have to say this is a rather growing and vibrant session on transmission education. They're really doing a great job. So yesterday was all structural. They do incredible. We had seen incredible technique demonstrated in an hour in the lab. I think the amount of information we got was fantastic. I think they did a Watchman, they did a mitral clip. Structural heart disease is truly thriving in this environment. Today was a coronary day, and so this morning we talked about imaging, why it's not used as much, why things are working, new studies. I think the two most important things we saw today were the OCT results. The results of Greg Stone's meta-analysis on imaging and mortality, which showed if you image, you reduce mortality. And then we saw and we saw a number of other studies demonstrating similar things. I had very small role today in talking about why we have so much good data, but we have so little use relative to the number of PCIs. And I just emphasize the fact that operators are 90% in the community and 10% in the academic world. Academics have the time and energy, and sometimes the guys in practice have other constraints. But they still have to give good care. They still have to deliver good care. Part of it is to be responsible to the patient and less worried about how long a procedure takes. And part of it is to understand that if you use the imaging, you get the best result of your stent and your long-term outcomes. And that's what every patient really needs. And that's kind of where I emphasize things.
And we talk about it every time. Why not accommodate? And the slow adoption of this technique is 15-19%. On a previous interview, there was a highlight that we don't have resources for the community physician to learn.
Correct.
So how we can teach them an easy, quick way?
Yeah.
And what platform? Is it Sky? Is it ACC? Is it, beside coming to these venues, but something has to be like a good library online where they can access and learn.
Yes. So two things need to happen. One, they need a personal contact with an operator that they know and trust. So a tutorial, a proctorship, a personal interaction. You come to my lab, we spend 3 days, 5 days, we learn imaging as I do it, or some other center. Then the second is an online resource just to have the didactic stuff done. And then a practicum where you're doing it and somebody watches you do it. So with those 3 steps, anybody can learn this. Now, we don't have a proctorship system set up for the community physician. It's hard for him to take 4 or 5 days and go off somewhere. So it has to be done 1 or 2 days. You work and you do cases together. Then he goes back and in the evenings we'll review cases or have somebody review them online. It is impressive to me today that David Cox, one of his partners or guy who works in his lab, says, "David, can you teach me to do IVUS?" That's the first time I ever heard anybody ask to be taught IVUS. And that means that there is peer pressure, there are guidelines, and there is a need for this to make sure you have good results that all of us in the academic mystery cloud world talk about.
So and patient maybe we should aware the patient that this is something should ask for.
Well, marketing to patients is sometimes a good thing and sometimes less a good thing. Ozempic, no. So I think that the patients should be aware that there is a difference among techniques, and that in generalities, the better techniques are using imaging and physiology and stent, good stent implantation. But it's hard to accuse somebody of not doing the right thing because they don't do it. But the guidelines are very strong in favor of imaging physiology, and
I wonder if you send a survey to all community physicians and say who would like to have a PCI with or without
I think they would say with. But you could, on that same
So they
thing.
believe, deep inside, they believe it's good.
Yes, I think they do. And you should always say, if I could provide you a proctor to learn IVUS, would you take advantage
Absolutely,
of it?
yeah, they would jump
So,
on it.
I mean, there's an opportunity, a business opportunity somewhere in there.
Yes.
So that's what I learned today.
Yeah.
And then the live cases this afternoon were very, very well done.
CTO and all that stuff,
Yeah,
absolutely.
yeah.
Well, thank you, Dr. Kern, for your time and for a nice overview.
Yeah.
And also keep emphasizing on physiology and imaging for every PCI in the cath lab. Thank you for watching us. This is Chadi Alraies from SIF 2024. Dr. Kern, thank you so much.
Thank you.